Good evening. Welcome you all to our 14th high powered talk show to advocate for breast cancer awareness and action for prevention. This program is the penultimate broadcast of our mega month long campaign, Breast Cancer Action Month, which encouraged people to move beyond awareness and take action for prevention and early detection of breast cancer. I am Kamal Narayan, CEO of ISW Council, India's premier institution for health advocacy, awareness, and behavior change. A lot of water flows under the bridge every October when it comes to mobilizing efforts for breast cancer awareness globally as well as in India. But still, we see this disease taking away lives of close to 90,000 women in our country annually. This made us talk about action now more than awareness. And we are thankful that Novartis India came along in this journey during which we tried to urge everyone who is concerned about the health of our people to not only talk about action but also walk the talk with action. Be it simple undergoing or encouraging women in our lives for self breast examination or making breast health as part of India's women health agenda. Despite the ongoing pandemic that impacted breast cancer care as it has impacted every other aspect of healthcare, the October 2020 has been historic in India for its fight against breast cancer and will be a trendsetter for future as it witnessed the setting up of a dedicated day, National Breast Cancer Action Day for October 21 by two of the most prominent women leaders and among the highest constitutional authorities of our country, the governor of Uttar Pradesh, India's most populous state, and Madhya Pradesh, again, a very important state of our country, and the governor of Manipur. This will also be historic because it brought together an unprecedented representation of over 50 plus top medical professionals, lawmakers, public health and policy experts, social and media influencers, and most importantly, breast cancer survivors to reiterate the message that breast cancer is preventable if we stay alert and is curable if we take effective action without losing hope. Through our collective and consistent efforts, we have reached out to close to 20 million people during this month of October. Let's have a glimpse of what happened in this campaign in the last 27 days. Breast cancer is the number one type of cancer in women today. To exhort and encourage all of us to move from awareness to action, ISW Council, in partnership with Novartis India, embark on month-long mega virtual conclave, Breast Cancer Action Month.
मुझे आज ब्रेस्ट कैंसर एक्शन डे से उम्मीद है कि जागरूकता और उपायों के बारे में लोगों को बताकर हम देश में ज्यादा लोगों के बीच कैंसर होने से रोक सकते हैं।
I'm confident that the contribution of the Integrated Health and Wellbeing Council will certainly help in checking and treating cancer.
Awareness around cancer, awareness around women health, awareness about around all the artificial things that we engage in, and vanity has its own impact on our health. And I think it's time to turn the tables on the other side.
the problem is really at two levels. One is, like I said, with the media centering a lot of communication around what is significant in that month. And the second is, as a society itself, we just don't want to mention the word breast.
We have to create a complete ecosystem so which can really help early detection, early treatment, and help patients live a longer and healthier life.
More and more ideas are emerging towards action, and I really appreciate that from awareness to action to make an impact is where we are moving.
I think from the relatives' point of view, we need to just give time to the patient, listen to the patient, do not force your views.
The first treatment of choice for most malignancies in the West is participation in clinical trials. So there has to be a change in the attitude of people towards clinical trials as well.
Preventing risk factors, making sure that all the incentives are aligned together. Everybody is working towards keeping the patient healthy rather than treating sicknesses. So that is, I think, maybe a utopian model right now, but I feel that is the only way out if India as a country needs to put its healthcare system together.
So when you say breast cancer, that should be the reply, yes, it is curable. Till the time you don't have a positive environment, nothing can be done. Secondly is we should not keep on bickering with each other that X is not doing, the politician is not doing, the NGO is not doing. There should be a connect. We should try to take the maximum out of whatever the resources are with us.
I think the more, nothing is really going to be enough in this. The more that you do, the better it is. I think it has to be everyone's responsibility in that sense. Since Dr. Sairam has already covered what media should be doing, my only request would be if since we have Dr. Christoph also, I think from the science point of view, if there can be some focus in terms of how newer therapies can actually work in this, because this is the era of precision medicine. How that can be focused on and how that can help in terms of reducing the costs.
There is hardly any master health checkups done by most of the diagnostic centers or hospitals. They don't include cancer checkup as part of the master health checkup. In this scenario, oncologists also has to be incorporated in framing these checkups from various sources. I think then only probably we will be able to diagnose them early.
You have to build it around the face-to-face, the physical contacts, which needs to be there to do a mammography. We cannot do it remotely, or if there's a blood test to be done. These interactions need somewhere to be there, but we need to integrate it in a system which supports at least the awareness, the risk assessment, and the education via digital platform.
I think right now what we need is early detection. We need to put up the capability in our country to enhance and enable early detection of cancer. And 10 years is not a long time, given the condition we are having. And with COVID-19, it's all aggravated. So women are not reluctant to take action, but we need to create that ecosystem for them to facilitate the action for them.
Big thank you to all of you for joining us.
So these were the highlights of what happened in the last 27 days of this Breast Cancer Action Month, which we have been driving at ISW Council with the support of Novartis India. The aspect of breast cancer prevention and treatment that we are going to discuss today is of colossal importance, as it encompasses the ways of overhauling our healthcare system in a manner that empower our women to seek and receive timely healthcare support for both prevention and cure. So we have a galaxy of some of the most esteemed speakers from different field, from the medical field, as well as those who have actually gone through the pain of breast cancer. Let me welcome today Dr. Vasisht Maniyar, Senior Consultant Oncologist and Director, Maniar Onco Care Center in Mumbai. Dr. Vasisht Maniar is a consultant oncologist and hemato-oncologist at the Maniar Onco Care Center in Mumbai. His areas of specializations are hemato-oncology, pediatric oncology, and solid tumors. He is a consultant at several prominent hospitals in Mumbai and Thane, including Bombay Hospital and Research Center and Asian Institute of Oncology. We also have with us Dr. Uma Dangi, consultant medical oncologist from Fortis Hospital, Mulund in Mumbai. Dr. Uma Dangi is an oncologist with almost a decade of experience in medical oncology. She has worked with Tata Memorial Hospital in the past, and her areas of expertise include breast cancers, lung cancer, as well as the several types of blood cancer, among others. So welcome, Dr. Dangi, on this show. We have with us Dr. Anant Bhan. He is an eminent researcher in bioethics and global health and public health policy advocate and an influencer. He is adjunct visiting professor in the Center for Ethics, Yenipoa University, Mangaluru, and immediate past president of International Association of Bioethics in Bangalore. We have with us Fran Mellens, Head of Marketing and Commercial Excellence for Asia Pacific, Middle East, and African countries for oncology at Novartis, Switzerland. Thank you so much, Fran, for joining, and Dr. Anant Bhan for joining us today. We have two very important people in this discourse. Shivani Jha, who herself is a breast cancer survivor. She has taken time out and has connected with us from New Jersey today. She is a co-founder of Spurs, A Touch of Faith. It's an organization to support breast cancer patients for prevention, for cure, as well as the various other, emotional and other supports needed for these patients. So thank you so much, Shivani, for joining us today. And we have Mr. Manish Joshi. It's a very important stakeholder again, somebody who has lost his wife to the breast cancer. He's joining us from Gujarat. His wife died after breast cancer relapse, and we will be listening from him that what it, where all, we could not, as a healthcare system or society, could not save the life of his wife. So thank you all, our speakers for joining us today. So, since we are talking about health system approach for, breast cancer management, breast cancer prevention, I think we have Dr. Anand Bhan is with us. Can he switch on his video? Okay, so I think Dr. Bhan is going to join soon. So let me just begin with Dr. Uma Dangi. Dr. Uma, you have been, you with your experience of 10 years in oncology and the way we see breast cancer cases increasing in our country. For last 27 days of our whole discussion, we have been hearing from all experts that, prevention, and especially when you are aware about the changes in your body, you are conducting regular breast exam. So the prevention is something which hold the key of breast cancer, to stop breast cancer from happening or to diagnose early. Where do you see as a healthcare system, are we able to provide that important support system for women across the country, not only in city like Mumbai, but even, maybe 200 kilometers from Mumbai in a small village, that they get regular, support in terms of screening, awareness, education, or if they are somehow diagnosed of breast cancer, the right kind of treatment support, which they can receive from their local healthcare system, as well as when they need expert, specialized care at a larger hospital?
Thank you for having me on this panel. It's a pleasure to be here. Your question you asked was whether, where I see this health system right now. So what I see is there is still a lot to be done in terms of providing healthcare to the masses. In cities like where I work, in metros, etc., there are the access to healthcare is much easier, but the same healthcare, including for breast cancer, is not so easily available to the rural areas or to the to the villages or to the small towns where and there is lack of education also in that area, where women are not probably very well aware of what symptoms are, what signs are. So those are the things that do hinder the what you call early detection of breast cancer. As far as prevention is concerned, I would say that one cannot actually prevent it completely, because there are risk factors for breast cancers which we cannot control. So there are like being a woman, being aging is one source, plus genetic factors. These are things that we are really not able to control. So there will always be a risk factor, but we can at least minimize it by taking appropriate actions. And also we can try and be aware of what are the possible signs and symptoms, which if they appear, we can go to the healthcare personnel and get ourselves tested. With the advent of COVID, now a lot of things are happening telephonically, teleconsultations, and we are also getting used to it now. We were not used to it so much before. So I feel that in areas where probably an expert is not available, or if there is if there is some hindrance to travel in current times, one can always opt for a teleconsultation or an online consultation, and try and get things sorted on time, so that they can the care can be started early.
Dr. Dangi, you have worked with Tata Cancer, Tata Memorial Cancer Institute also, and also, in your current practice in Mumbai, in Fortis. I'm sure you must be getting a mix of, patients, both from the urban areas as well as coming from, far off rural areas also, from Maharashtra, and in Tata, people from across the country go for cancer treatment. What has been your experience in terms of progress of cancer when you see a urban patient or a rural patient? As we see that in most of the cases, especially in rural areas, the cancer progression, before it is actually diagnosed, it goes to stage 3 or stage 4. What is your experience in that, and what probable reason you feel that why do we get more progression in terms of among the women who are coming from the rural background, and how we can stop it? What are the interventions you feel can be brought in?
So you're perfectly right in saying, there is definitely a disparity in the stages what we see urban women coming with breast cancer and in women who are from rural area. There is a lot of, obviously one has to understand the lifestyle is also completely different there. Women there are more into, they're probably so engrossed in their families, they tend to neglect themselves. This has been the Indian mindset of the woman. Who has been raised in India, all women know that the family comes first, the children come first. So what happens is they do tend to neglect themselves. And obviously there is, we are not so open about discussing about, certain breast cancer, cervical, other type of cancers which are more intimate, so that, they're a little shy in saying that, oh, I have found a lump, or, going to the doctor. And the other important thing here is, because the breast cancer lump, it starts as a painless swelling. So that is one of the reasons that many patients try to ignore it, because it is not paining. So something which is painful, you tend to go to the doctor very early. But something which is not causing pain, it is just there, you tend to say, oh, it will go away. Let me see this month. Let us see if it starts paining. And that is the reason probably they don't come in the first instance when they notice it. The way to go about it, so obviously I've worked in a rural area, and I know that the patients who come there are they come with really bad disease, T4 stages, like fungating masses coming from the breast completely destroyed. So those are the things that we do see in rural areas even now. The way to do it, the way to go about it would be to educate women. That is the first and the most important thing, I feel, because even if we can't prevent it, if we can educate each and every woman that, you know, this is the sign and symptom, you must understand that if this is there, that you must come. And this we can start even in schools, colleges, you know, in women where there are young women who are learning. So if we start it there, then I feel that we can and they can tell their it has to be like a chain. I tell one person, that one person goes and tells somebody else, and somebody else, and somebody else. So it is like a chain of events. And then this way we can kind of educate all the women about the early signs and symptoms, and maybe they will try and come. And we have to be comfortable to talk about it. There is sort of discomfort, especially in, you know, to talk about it with your with a male colleague, or, you know, to go to a male, you know, something like that. So it's a
Or
little,
somebody in family.
yes, even in somebody in the family. So it's a little awkward. Oh, I don't want to. And then the fear of the diagnosis, that is also very important, you know, when they wonder, oh, it could come positive, but one cannot deny if it is there. So, you know, that has to be told that. And we have to tell it more positively, in the sense that even if it is there, don't worry, we can take care of it, it can get better, you can be cured. So that kind of, that fear has to go, because the fear of diagnosis, the shyness of going to the doctor, and obviously the lack of knowledge that this could probably be. So these are all things, I think, that contribute to late diagnosis in a woman.
Thank you so much, Dr. Uma. But since we are talking about how rural patients or women can also get aware and take action about it, we have with us Mr. Manish Joshi, who is joining from Gujarat, a rural part of Gujarat. So मनीष जी, आपने सुना अभी डॉक्टर उमा बता रही हैं कि जो ब्रेस्ट कैंसर के ज्यादातर केसेस होते हैं उसमें चूंकि पेन नहीं होता शुरुआत में, घर में औरतें जो है उनको उतनी प्रायोरिटी नहीं मिलती भारत में कि वो अपने हेल्थ के जो इश्यूज हैं उनको लेकर के मेडिकल हेल्प उनको मिल सके। नॉर्मली क्या होता है कि घरों में अगर मतलब किसी लड़के को या आदमी को तकलीफ है तो वो तुरंत डॉक्टर के पास चला जाता है और राइटफुली चला जाता है, और जब अगर वही तकलीफ किसी महिला को होती है घर पे तो वो या तो महिला खुद इग्नोर करती रहती है कि ठीक हो जाएगा, अभी थोड़ा सा पेन है, कल ठीक हो जाएगा, कुछ घर के घरेलू नुस्खों से कोशिश करती है, या जो है घर के लोग इतना इनकरेज नहीं करते कि वो सही समय पे वो करें। आपके घर पे एक ऐसी ट्रेजेडी हो चुकी है जहां पर ब्रेस्ट कैंसर का केस हुआ, उसके बाद आपने देखा कि पहले 6-8 महीने, आपने बताया कि 6-8 महीने तक उसको डायग्नोज नहीं किया जा सका, और उसके बाद डायग्नोसिस हुआ, तब थैंकफुली वो क्योर भी हो, मतलब इट गॉट काइंड ऑफ मैनेज्ड एज वेल। तो आपका क्या एक्सपीरियंस था? क्या आपके घर में भी यही टिपिकल स्टोरी थी, या आपने जल्दी इस समस्या को समझने की कोशिश की और जल्दी हेल्प, और आपको हेल्प नहीं मिल सकी क्योंकि आप एक रूरल एरिया में थे, या आपको पता ही नहीं चला कि ये कैंसर हो सकता है?
नहीं, उसमें क्या है कि यहाँ पे हमारे घर में तो पूरा सपोर्ट था मेरी वाइफ को, और हम लोग इसमें पूरा मतलब पहले से थोड़ा बहुत जानकारी रखते भी थे। हमने मेमोग्राफी भी करवा लिया था, लेकिन डॉक्टर ने मेमोग्राफी का रिपोर्ट पूरा ध्यान नहीं दिया, उसमें स्वेलिंग बता रहा था, तो उसने बोला नॉर्मल स्वेलिंग है, ठीक हो जाएगा, ऐसे ऐसे करके 6 महीना निकाल दिया। फिर बाद में डॉक्टर चेंज किया हमने, तो उन्होंने हमें FNAC रिपोर्ट करवाया, उसमें पूरा रिपोर्ट निकला। फिर आगे जाके हमने अहमदाबाद में अपनी ट्रीटमेंट चालू की। तो हम हमारी तरफ से तो एकदम क्लियर रेडी थे ट्रीटमेंट के लिए, और जो भी उसमें रिपोर्ट करवाने थे वो हमने करवाए भी थे, लेकिन पूरा उसके ऊपर फोकस नहीं करे डॉक्टर।
तो आपका कहना है कि शुरुआत में मेमोग्राफी में साइंस होने के बावजूद भी उसको प्रॉपरली डायग्नोज नहीं कर पाए डॉक्टर?
जी,
तो
जी।
आपको अपनी तरफ से कोई कंसर्न हुआ कि इसको और को किसी और को भी दिखा लेते हैं, इसमें कुछ आया है? मेमोग्राफी कराने के बाद आपने कोई सेकेंड ओपिनियन लेने की कोशिश नहीं की, या
6 महीना तो हम वही डॉक्टर के ऊपर भरोसे पे चले, फिर कोई रिजल्ट मतलब नहीं मिल रहा था, तकलीफ बढ़ रही थी, तब जाके हमने दूसरे गायनेक इधर, तो उनसे हमने कंसल्ट किया, उन्होंने FNAC रिपोर्ट करवाया हमसे, उसमें एकदम साफ आ गया कि भाई ये चीज है, कैंसर है, ब्रेस्ट कैंसर। फिर आगे जाके अहमदाबाद से हमने ट्रीटमेंट स्टार्ट करवाया, तो पहले कीमो लगा, फिर ब्रेस्ट रिमूव हुआ और बाद में रेडिएशन भी हुआ। पूरा 6 महीना ट्रीटमेंट चला एकदम फर्स्ट क्लास। मेरी वाइफ एकदम स्ट्रांग थी और हम भी उसे पूरा सपोर्ट कर रहे थे। तो पहली ट्रीटमेंट का तो हमें एकदम फर्स्ट क्लास रिजल्ट मिला, एकदम ठीक हो गया। कीमो में ही हमारा पैट सीटी का जो रिपोर्ट आया, दूसरा रिपोर्ट, वो एकदम क्लियर था।
फिर उसके बाद रिलैप्स का क्या कब हुआ और आपके क्या रेगुलर आपने चेकअप्स वगैरह करवाए उसके बाद?
हाँ, हर 3 महीने हम चेकअप करवाते थे। यहाँ से अहमदाबाद जाते थे, जो भी मतलब उनके सपोर्टेड ब्लड रिपोर्ट है, फिर सोनोग्राफी है, सब कुछ हम करवाते थे टाइम टाइम पर, और सब नॉर्मल आ रहा था। फरवरी 2019 में हमारी बेटी की हमने शादी भी की, एकदम सही फर्स्ट क्लास ढंग से, कोई मतलब उस टाइम दिक्कत नहीं थी। मार्च का रिपोर्ट भी एकदम क्लियर आया था, मार्च 2019 का। फिर जून 2019 में हमें सिम्टम दिखाई दिए, तब जाके बीच में से हम गए तो दोबारा पेट स्कैन किया गया, तो उसमें शरीर के अंदर काफी जगह पे स्पॉट पाए गए थे।
Okay, so Dr. Uma, what can be this probable case that despite that once it was kind of completely managed, and despite going for regular checkups and all, the relapse was much more stronger, I think what he's saying, and then ultimately the life was lost. So could there have been a better way of managing this particular incident?
So, see, any cancer, there are very few cancers that you can count on the tips of your, in your fingers of your hand, who are 100% curable. So there is always a chance. Early breast cancer, the cure rates are as high as 90-95%, but there is always a chance that the disease may come back, or there is a chance that, woman who already has had one breast cancer, there is a risk of developing a second breast cancer as well. So that is why after treatment, we need to do a regular checkup and regular screening for second breast cancer, and look for any recurrence. Unfortunately, it depends also on the stage of the disease at diagnosis. So like he said, so she received chemotherapy first and then she underwent surgery. So she probably had a locally advanced disease to begin with the way it was treated. I mean, although having not seen the reports, very difficult for me to say that. But if that was the case, then the risk of the cure rate of the cancer goes down as the stage increases. The first stage may, if it is 90-95, second stage it comes down to say around 80, and it comes down further with third. And fourth stage, as we know, is not curable in the current scenario. So probably maybe because it was a locally advanced tumor, that's why the disease came back. But I'm sure that if she's received radiation, chemo, surgery, everything, so she's probably been managed well there.
Thank you so much, Dr. Uma. So let me go to Shivani. Shivani, you have been working in various, public health aspect in India on social work, and you yourself is a cancer survivor, and I think it has been a recent. So would you share what has been your story in terms of when did you get to see or get to know that you are having breast cancer, how it was diagnosed, and that what kind of treatment followed, and
so thank you so much, Kamalji, for having me in this esteemed panel. And I think the fact that everybody reiterates all over the world that early diagnosis is the key to treatment and cure. And your survival rate depends a lot on at what stage it was diagnosed. So I am a living testimony of the fact that early diagnosis can cure, treat, and help people survive. Because I came to US in 2016, and in India, in India, as a common Indian woman, I would say I knew there is cancer in the world. They have it, or they get it, but something like imagining like cancer can happen to me, breast cancer can happen to me, that was like beyond imagination. I would say even in my nightmare, I did not assume that. I thought it was something like they think, like they get it, they had it, they have it kind of stuff. So in US, it was just like, I guess it was destiny that I came to US. And in US, you have something called an annual primary health checkup, which is mandatory for everyone. And the kind of tests or the kind of investigations that are done during that annual physical exam are based on your age factor, your risk factor, and pre-existing conditions that you have. So in US, I just walked into my primary care physician's office for my routine checkup. And based on my age factor, breast examination was a part of the routine examination. So my primary physician said that, Shivani, I feel a small lump in your breast. Can you feel it? So I tried to feel it, but I couldn't feel it. I mean, I was like, really? She said that, why don't you get a mammogram done? So next day the mammogram was done and it was right there on my screen. I could see that lump in my right breast. And then I was like telling myself, okay, maybe it's just a lump. It's going to be fine. Maybe some kind of cyst or something. So then the sample was immediately sent for biopsy. And yeah, within few days, I got this phone call saying that, sorry, Shivani, not I think you, but your biopsy results have come and it does have cancer cells. And I don't remember what they said beyond that, because beyond that, I just don't know what they said. And I think the first reaction that I had was like disbelief. I was like, no, this is like my husband was more nervous than me because he realized that this has happened to my wife. But for me, it was like disbelief. No, I'm going to be fine. It's not cancer. It's okay. So it took me like a couple of days to actually accept the fact that, yes, I have breast cancer. And so disbelief was my first reaction. And the second reaction was the fear of death. Because I came from India like just about a year ago. And in India, generally, the very word cancer, it's somehow associated with that death sentence. So that was my second reaction, death, fear of death. And then, me and my husband, we struggled looking for oncologists and everything. But I was like, I didn't know what was happening to me. And then someone who's like very dear to me, she told me that she herself is a doctor. She told me, Shivani, you know what? Cancer is a mind game. You have to defeat this disease mentally in your mind before your body fights this disease physically and takes it out of your body. And I think that was the mantra with which I started my cancer journey. I don't know why, but this thing was like in my mind that I have to defeat it mentally, and only then my body will be able to defeat it physically. So then the oncologist and I had a very aggressive form of breast cancer, which is like triple negative breast cancer. And because of my age factor, and when they started tracing my family history, my paternal grandmother had breast cancer. So then they did the genetic testing, and I was also diagnosed with the BRCA gene mutation. So I think, and before I was diagnosed with this genetic factor, and I came to know that even genes can increase your likelihood of having cancer. I worked in India in the public health sector for several years, almost like 15 years. But I didn't know that breast cancer risk can be associated with your genetic component as well. So then, they followed a very, very rigorous regimen of chemotherapy. And
you were diagnosed in early stage.
Early stage, yeah, I was just stage 1. So generally,
situation.
Yeah, generally, so a triple negative breast cancer with a BRCA gene mutation is kind of an aggressive and difficult to treat cancer. That's what they generally say. But because of the fact that it was diagnosed very early in stage 1 through a routine screening that happens here, I was saved.
Thank you so much, Shivani. We will continue with this to understand more. The best.
Yeah, sure.
You got to know about it on time, despite it being aggressive, despite having genetic vulnerability to this, but you you could get out of it. And we
Yeah,
have
and today I'm cancer free. I'm like cancer free. I'm in remission, 2 years of survival. And I hope God and, like good wishes of everyone keeps me safe always. Thank you.
everyone, everyone's wishes are with you, and you are a living testimony, as you said, of this fight against cancer. And we are
Right.
seeing Manish ji's story that despite knowing, and I think 6-7 months which he lost in not being able to diagnose that it was cancer, that is, I think, also talks about the stories of these two countries, our public health system and healthcare system. Now we have
Right.
Dr. Anand Bhan, and Dr. Anand Bhan is a global public health expert. He understands public health systems across the country and across the world. And as we are today talking about that, how we change this whole, have the system approach towards healthcare, which is more like your engineering terminology. So, Dr. Anand Bhan, you heard two stories, I'm sure, of one from Manish ji from Gujarat, where he lost his wife's life because I think primarily might be because of the delay in diagnosis. And then we have Shivani, who I think fortunately was in US, and through a annual primary checkup, which is mandated there, diagnose it early and is now free of cancer. Dr. Bhan, how do you see, for India, how can we get something like what happens in US?
Sure. Thank you, Kamal, for having me. So I think these are interesting questions, and it also tells us a few things. Dr. Uma was rightly pointing out part of the challenges that women's health in India has been largely relegated to, care for a woman when she's pregnant or could get pregnant, which is in the reproductive age group. That's where the touch points of the health system are most active. When she's about to get pregnant, when she's pregnant and probably in a lactating period, we don't really have many systems which respond to the health needs of women beyond that, right? Anything which requires us to focus on breast cancer prevention, promotion, or treatment will require us to have more of a life cycle approach. And that means that we need to have a way where women are comfortable going to health facilities on a regular basis, and not just for their reproductive needs, but for any other health need, which includes, going for regular checkups, for example. That doesn't happen right now. The only time a woman typically goes to the health system is when either, as I said, she's getting pregnant or she needs to take her child for vaccination, right? The other thing is probably a socio-cultural issue. The socio-cultural issue being that women will probably relegate their own health needs last within the family. So anyone, as you were rightly pointing out earlier, and I think we heard stories towards that as well, that, whenever there is a male member of a family or a child in the family who needs healthcare, they will be prioritized much before the woman's healthcare needs. And sometimes, there is a culture of silence. Sometimes there is just, this is just not a priority for the family. That we see that also in health systems in terms of the expenditure on health, and families will spend much more on the child and the child's health than they might spend on the woman. It's also food, for example. Who gets to eat last in the household? Who gets the scraps? Does she eat with the rest of the family, or does she serve everyone and then eat? So I think there is a socio-cultural element to it. Having said that, there is a possibility of moving forward. I think one way of doing that is what we've been trying to do over the last couple of years, the comprehensive primary healthcare reforms. If we can get our health and wellness centers to actually get functional, if we can get these centers to not just be about linkage to treatment or referral, but also to focus on prevention. And prevention is in many aspects of actually telling women what to look out for, what kind of checkups they should be doing themselves, getting our ANMs, our ASHA workers to get involved in encouraging clinical breast examination, breast self-examination, referral at an early warning period. If there is a warning sign, then referring them out to a clinician who can do further management is at the right period, because the later they go in, the more complications and the more difficult it is to manage, right? So that's the prevention part of it. The promotion part being, everyone needs to understand that this is a priority. We need to all know that this is a major killer for women in our country, and women need to know what to do. How can they prevent it? How can they identify any kind of changes early enough that an intervention would be useful? And then we need functional health systems where this can be managed both at the primary level, the secondary level, and the tertiary level, which means that it should not be the case that only if you go to a medical college hospital or a major big government hospital in the city or a corporate hospital will you be able to get good quality care, because you will have a shortage of oncologists always. But at least our medical doctors at the lower levels of the healthcare chain need to know what to do and what to look out for and be able to at least do basic management and then refer out, right? I think partly what we are seeing is that in the specialization of medicine, sometimes some of these basics are lost out. And there is a lot of loss in terms of women who might go to a primary health center with certain complaints, but then are told, well, sorry, we cannot manage you. You have to go to the district hospital or you have to go to the big city to get care, and there is a loss to follow. And we don't want that loss to follow, because in that loss to follow up, or while they are waiting for they might say, it's okay, I will manage. And by the time they actually have serious symptoms, it will be too late, or the disease is already quite advanced. So we need to make sure that our referral chains are also built in such a way that we can get our referral done in an early enough matter. So I think it's quite possible, but we need to probably address it at multiple levels, both at the health system level and the social cultural level.
So socio-cultural changes are needed, and the referral system also need to be operational effective. And because I think the case of Manish ji is, I think the typical case of that, the referral system and then the identification of disease. Because what we can understand from his submission is that despite that he went for mammography, and despite that there were a certain kind of swelling, some lumps, but the treating doctor did not alert him that you need to seek the specialized care. He could have gone to Ahmedabad earlier than 6 months later. So we'll come to that. Thank you so much, Dr. Bhan, for highlighting that. Let me go to Fran. Fran, you are taking care of multiple markets and geographies as part of your role in Novartis. What kind of apart from, so US is one a big success or a big I think benchmark which any other country can achieve. But since you have been working with African countries, with Asia Pacific countries, is there a better healthcare system approach which we in India can emulate and try to achieve outcomes?
Thank you. Thanks, Kamal, for the question. And also, I just want to thank everybody else who's on the panel. The conversation is a really rich one. It's a great question. So I've been working in healthcare for over 20 years, the first 10 of which was in consulting, where I was looking at various geographies. The last 10 have been with Novartis, where I've played global roles, and then more recently now running this region. The short answer to your question is the perfect healthcare system doesn't exist. And Shivani has had great care in the US, but I think she could also be the first person to say the US system is also not a perfect one. There are plenty of people who are underserved in the US healthcare system. What we look at from a system perspective is there are different controls that you can look at that then create side effects of the system. So you need to look at the financing and the purchasing that takes place, because that drives a lot of the access from a healthcare perspective. But then, as the discussion today has said, you need to look at the organization and the setup, because that leads to the quality of care that's provided to patients. And finally, you need to look at the efficiencies in the system. And the collaborations that need to take place across a healthcare system, because the reality is the size of the issue is too great for one organization or one government or one NGO or one patient association to take on. Everybody needs to work together. One of the biggest, I think, advances from India's perspective has been around the creation of the funding So Ayushman Bharat was a huge step forward for the country, and then PMJ to make sure that there is that funding available for, you know, the bottom of the pyramid. But that's one element of the healthcare system. And then what we've been talking about today, you know, one of the things with PMJ is the first point of care is the hospital setting. But if we want to take, you know, improvements from an Indian perspective, is where is the point of care? And, you know, the majority of the population lives in rural areas. And so we need the first point of care to be in the rural areas. So, you know, can I see a system who has done that well? There are some pockets of excellence. So I would say that Vietnam has recently looked not from a cancer perspective, but from a heart health. And if you go into any hairdressers or nail salon or pharmacy, you can have your blood pressure taken, which, you know, immediately picks up if you have hypertension. And then you know that you need to go and have, you know, that first point of care. And another system would be Rwanda in Africa, which again has looked at how can you use the size of the population. And, you know, one thing India has is manpower and woman power. You know, you have both. So, you know, how can you take the resources of the people, make sure that you're upskilling and training people so that they can be that first point of care to help with the mindset that we heard around screening. So, you know, how can you have people who are making it clear that, you know, women need to put themselves first, because if you don't put yourself first, then you're not going to be able to care for your family. So you need to look after you first and then your family. So from a mindset perspective, they can do it, but then they can also help with the screening, you know, the screening that Shivani had, as she, you know, so nicely articulated for us, she couldn't pick that lump up herself. So, you know, she needed that support and care. So how can we be upskilling individuals down in the rural areas to be helping with that screening and diagnosis? Because, you know, Dr. Uma mentioned over 50% of cases in India are presenting with late stage disease. And that makes it more expensive to treat, but it also means that the outcomes are not going to be as good. And I think, you know, any change that takes place for the efficiency of the healthcare system in India has got to be targeted at the goal of increasing the 5-year survival rate for Indian breast cancer patients, to get it to, you know, above that global average, not to be below the global average, but to be above the global average.
Thank you, Fran, for you know, bringing these two important examples also, and I'm sure we can discuss more on that. But before this, because I think Mr. Manish, you know, maybe having some other things also. So rather than, you know, keeping him in this discussion, I would request him, Manish जी, अगर आप ने जो कैंसर की लड़ाई लड़ी घर पे और उसके बाद वो रिजल्ट नहीं आ पाए, तो आपका क्या मैसेज है लोगों के लिए जो देख रहे हैं इस समय आपको, या जो इस वीडियो को आगे देखेंगे, उनके लिए आपका क्या मैसेज है? कैसे हम ये कोशिश कर सकते हैं कि कैंसर से जान ना जाए और उसे बचाया जा सके, जहां तक कि प्रिवेंटेबल कैंसर्स हैं? ब्रेस्ट कैंसर काफी हद तक प्रिवेंटेबल है, अगर टाइमली डायग्नोसिस हो जाता तो शायद जो मिसफॉर्च्यून आपके साथ हुआ वो नहीं होता। तो आपका क्या मैसेज है जो लोग देख रहे हैं?
बस आपको अगर थोड़ा सा भी डाउट जाए कि भाई ये कैंसर जैसा कुछ दिख रहा है, तो आपको तुरंत उसकी जो भी मतलब रिपोर्ट कराना है, आपको डॉक्टर से मिलना है। अगर आपको डॉक्टर से सेटिस्फाइड नहीं हो रहा है तो आप तुरंत दूसरे डॉक्टर का ओपिनियन लीजिए, और जो भी आगे डॉक्टर बताए इस तरह से आप उसमें आगे ट्रीटमेंट करें, तो मतलब आपका रिजल्ट अच्छा आ सकता है। जैसे शिवानी जी ने बताया कि कैंसर पूरा माइंड गेम है, वो एकदम सही बात है उनका, क्योंकि पहली दफा जब हमारी वाइफ का हुआ तो वो एकदम माइंड से टाइट थी, एकदम बराबर थी। तो पूरा फाइट हमने सही तरीके से दिया, रिजल्ट भी अच्छा मिला, लेकिन जब उसने सुना कि मेरे को दोबारा हो गया है तो भी वो एकदम सही तरीके से फाइट दे रही थी, लेकिन लीवर अंदर खराब हो गया तो उसकी वजह से जो जॉन्डिस हुआ, फिर उसके आगे हमारा कुछ नहीं चल पाया जॉन्डिस के आगे, तो उसमें हमारी मतलब वाइफ की डेथ हो गई। बाकी कैंसर लास्ट दिन तक एकदम पूरा कंट्रोल में था, कोई फैन भी नहीं था, कहीं पर कुछ भी नहीं था। तो जितना अगर अवेयरनेस रहेगा उतना अच्छा रहेगा, और जो डॉक्टर बताए उस हिसाब से आप अपने को केयर करना है और पूरा परिवार को सपोर्ट करना है, घर वाले को, कि भाई पेशेंट को ऐसा नहीं लगा कि मेरे को कोई बड़ी बीमारी हो गई है, नॉर्मल बीमारी है वैसे उसको फीलिंग कराना है और उसको पूरा सपोर्ट करना है, तो आपका रिजल्ट अच्छा आ सकता है।
Thank you so much, Manish ji. And just to summarize to our viewers what Manish ji is saying, that and very important message for everyone, that if somebody in your family is having cancer, do not let her feel or him feel that cancer is a big disease. Make them strong to fight against this disease. And it is
सर आपको मैं बताना चाहता हूँ कि हमने कोई भी ट्रीटमेंट नहीं छोड़ा है, कीमोथेरेपी, रेडिएशन, फिर टारगेट थेरेपी, हार्मोन थेरेपी, फिर सर्जरी, जितनी भी जो कैंसर की ट्रीटमेंट है, ऑन्कोसेप रिपोर्ट भी हमने करवाया था, उस हिसाब से हमारी टारगेट थेरेपी भी चल रही थी, लेकिन हमको पूरा रिजल्ट नहीं मिल पाया। कुछ कोई मतलब हमारा नसीब खराब होगा, जो भी कुछ होगा, लेकिन उसमें हमने कहीं पर भी कसर नहीं छोड़ी थी। हर समय समय पर पैट स्कैन भी करवाते थे, सोनोग्राफी भी करवाते थे, उसमें कहीं पर भी हमने अपने हिसाब से कुछ बाकी नहीं रखा था, लेकिन कुदरत ने हमें सपोर्ट नहीं किया।
We are sorry about that, Manish ji, but आपने अपनी तरफ से पूरी लड़ाई लड़ी कैंसर की और पूरा सपोर्ट किया अपनी वाइफ को, जितनी ज्यादा से ज्यादा ट्रीटमेंट की पॉसिबिलिटीज हो सकती थी उसको फॉलो किया, ये बहुत बड़ी बात है। और सबको
एक बात आपको मैं बताऊं कि मेरी बीवी इतनी स्ट्रांग थी कि जब लास्ट ट्रीटमेंट का हमारा मतलब आया टाइम, तो डॉक्टर ने बोला कि आप अपनी वाइफ को चैम्बर से बाहर भेज दो, हम अकेले डिस्कस करेंगे। तब मेरी वाइफ ने मना बोल दिया कि अभी तक जैसे हमने डिस्कस किया है उसी तरह से मेरे साथ डिस्कस होनी चाहिए, मेरे को क्या हुआ है, क्या होने वाला है, ये भी मेरे को पता होना चाहिए। तो वो पूरा डिस्कस में पूरे साथ रही थी और आखिर तक पूरी जंग लड़ी थी, डॉक्टर को भी पूरा सपोर्ट किया था। तो आप जितना पेशेंट को सपोर्ट करोगे तो वो अपने आप मतलब मजबूत बनेगी और कैंसर से लड़ सकेगी, तो आप पूरा उसको सपोर्ट दो पेशेंट को।
थैंक यू, वेरी इंपॉर्टेंट मैसेज मनीष जी, थैंक यू फॉर आप हमारे साथ जुड़े और आपने ये शेयर किया, ये बहुत अच्छी मतलब बहुत बहुत धन्यवाद आपको इसके लिए। और आप अगर जुड़े रहना चाहें जुड़े रहिए, और अगर कुछ और शेयर करना चाहेंगे तो, और अदरवाइज आप अगर डिस्कनेक्ट करना चाहें तो, बट आपने समय निकाला, थैंक यू सो मच। So Dr. Uma, Dr. Anand Bhan is saying that awareness at a lower level, at a rural areas where you don't have that healthcare infrastructure available is important, and then more than that, important is that you have the right kind of referral also, of which we see Mr. Manish might be one of the victim of not having the right kind of operational referral system. What is, as per you, is the missing link here? How we can fill this gap as being a practitioner in this specialty? How do you feel that how we can empower or enable even a primary healthcare worker that he or she can help identifying early malignancy or any kind of initial stages of cancer, which can then be referred to maybe a better healthcare facility?
Dr. Bhan actually very nicely summarized the lacunae and what we can do to currently improve our healthcare structure. Taking from him, I would say that it would be very important to train these workers, these Anganwadi workers or these PHC healthcare people, where how to do a proper clinical breast examination, what all to look for, what all symptoms to look for, what if a patient comes with particular set of symptoms, what to suspect, how to examine, and in case try and detect the breast lump early, or try and detect any kind of sign, because lump is just one of the symptoms of breast cancer. So what are the signs that they should look for, which could probably tell us that, this could possibly might be a case of breast cancer. And then even if a mammography is not available in the PHC, if there is a district hospital, and there should be a referral system where, if it is identified in this particular set of rural areas, then it goes to that particular district hospital, and from there should be at least a basic mammography machine with a radiologist who can look at it and tell us whether this is looking suspicious or not. And from there, when they go there, get themselves tested. And if there is any requirement, like I even said like I said earlier, telemedication, there is something which is going on. So even if you don't have an expert within the hospital, within the district, you can consult somebody on the phone or online, maybe send the images. Technology is really on our side here, and we can really utilize it to that extent. I do get reports on WhatsApp, I get reports on my mobile, so we can do that and try and get an opinion, and if required, try and send the patient to a hospital and get the treatment organized. So this way, if we can create a sort of a chain or a link, then maybe we can detect early. So training these ground workers, who really go, and I have a feeling that women living in the villages, they are probably more connected with these workers, and they are more comfortable with these workers. Somebody who comes from a big city, and then there is a sort of like they feel that they are somebody big, and they don't want to open up. But somebody who's living with them, they are probably more prone to opening up and telling them about the symptoms. And we really, if you look at cervical cancer, we have really fought it well, and now it's not the topmost, which used to be before. And this is basically because of screening. This is because of education and all those. So similarly, if we apply the same probably things to breast cancer, we can definitely do it.
Thank you. The very important point you are mentioning, Dr. Uma, that how technology can be used, and it is quite prevalent. People are using it, and then how we can actually use it in a more systematic manner so that we are able to ensure that the intervention reaches. Dr. Anand Bhan, again, the troubleshooting of the system. There is a trouble, people who need certain kind of health intervention because of multiple reasons. You said about socio-cultural problems, not giving priority to women health beyond the reproductive age of women, and multiple other aspects. But at the same time, if we would want to troubleshoot the system so that at least something like breast cancer, which is preventable, we can save a lot of lives, which is a big number, almost 90,000, an annual number which we are seeing as death. What kind of intervention you feel can be brought in, and especially like Fran is talking about that in Vietnam, even hypertension is being checked at salons and at beauty parlors, and similarly she is giving an example of Uganda also. We are also seeing these days that because of COVID-19, I think every place we go, our temperature is being checked. Can there be this kind of ways to eliminate diseases or identify these diseases early at all level, maybe ASHA workers, or we are over expecting from ASHA workers, because everyone for everything brings in ASHA worker as an important stakeholder. So are we over expecting them? Are they actually capable of delivering this kind of outcome?
Sure. So I think it is possible. I think some level of upskilling certainly can be done, and our frontline health workers certainly have a role to play. If you look at health, the whole concept of health and wellness centers right now as part of Ayushman Bharat, often we only keep hearing about the insurance component. An equally exciting, if not more exciting part is actually the comprehensive primary healthcare paradigm. And part of the rationale of changing our sub-centers and many of our PHCs, the primary health centers, to health and wellness centers is exactly this, that at least for adults beyond a certain age, you would have regular screening for oral cancer, for breast cancer and cervical cancer, because we know those are the three big cancers, especially in rural areas. And that there would be mechanisms for regular screening for all of these, that would require obviously you to do outreach as well as have facilities level screening programs in a way that this is done locally, it is contextual, it is culturally appropriate, so that women are comfortable enough going to the local subcenter. Now you can make, you can catalyze that by using existing mechanisms, whether that's the Anganwadi system, whether if it's women's collective, self-help groups, having a way for women to feel comfortable to talk to each other and understand what are the kind of things they should look out for and when they should be going for checkups, when they should be going for screening. And in many ways, making it a part of the routine health system activity so that, it's a part of what you do every year. You go for screening, and as part of that screening, you get screened for these multiple cancers, you get screened for hypertension, you get screened for diabetes. So it's part of the multiple things that you do. It's not specific just to breast cancer. But then it normalizes the fact that you need to take care of yourself and you need to go to a health system to get checked up because you are at risk of all of these health conditions. So, as we all know, we've moved beyond a paradigm where as Indians, we were earlier primarily more susceptible to infectious disease. We now know non-communicable disease is probably the major killer, right, for most of our populations. And that rates of hypertension, diabetes have gone through the roof even in rural areas. And similarly, we need to have a mode where everyone understands that we are all susceptible to cancer. And the sooner we realize and the sooner we go to a health system for our regular checkups, and the earlier it is picked up, the better outcomes we will see. So that is part of our health promotion. That's part of ensuring that the education programs, that we normalize it so that there is no shame to it, that it is seen as a regular thing that you do in the same way you would go for your sugar levels to be checked or your BP levels to be checked. Many people are comfortable getting that. So why not also for cancers? So I think we need to normalize that, and that change hopefully is something we can do at all levels of the health system.
So, Dr. Bhan, you mentioned about this health and wellness centers, which definitely, I think, even more important part of this whole Ayushman Bharat concept, because prevention is I think, the best cure. And if, that is an effective system we have, it definitely will reduce even the burden on the insurance side of it. How much it is operational as of now? We were, I think, expecting to have 1.5 lakh operational centers by, I think, 2022 or 20. And how much of it is, did you get a chance to visit any one of them? And are they attractive enough for people to actually walk in and get, these multiple preventive health support or checkups done?
Yeah, so I did visit a couple of them, and as this is a transition period right now, so we know changes happening. We know it depends also on the states. In some states, it's just sub-centers. In some states, it's sub-centers and primary health centers, and there is a process involved. It will take time. But what is also happening in many states, I know in the state of Madhya Pradesh, where I'm based, that they have been recruiting community health officers. So these are mid-level care providers who will be playing a leadership role at these health and wellness centers. And they've gone through a 6 months structured program where they are upskilled. So many of these are already nurses, or they might be Ayush doctors, for example, and they're skilled up in a way that they will be able to manage the health and wellness centers. And many of these elements of care, as we were talking about, are the kinds of care that they would provide. So hopefully with time, over the next few years, we will see more and more health and wellness centers come up. And that, I think, also pushes the idea of wellness being an important component of a health system, and a health promotion component of the health system, because often we only think of the health system from a curative perspective, but as you were also rightly saying, the prevention and promotion part of the health system is equally important. If we are to bring down our rates, we need to ensure that there is a culture of picking up any risk elements early enough in our communities. And if we can do that at the primary level, that's probably the best catchment area. To expect us to be able to do that at secondary level or tertiary level is going to be extremely difficult.
Thank you so much, Dr. Bhan. Shivani, you mentioned that in US we have the practice of mandatory annual health checkup. How is it mandatory? Is there any penalty involved to that if you don't go to the health checkup, you are going to be penalized for something, or you are going to incentivized for something? Because in India, what happens normally, we tend to stay away from hospital or any clinic or center or anything. Even, and that has become that is quite a norm in, especially in rural areas. So if we want to get these people come to a wellness center, have an annual checkup, apart from nudging them to seek healthy behavior, uh, what it mandatory the word mean when you mentioned about it? You are on mute, I think. You are on mute. Sorry.
Okay, so I want to tell you two things. One is that I will talk about this health checkup, which is basically when you get a medical insurance. As part of the medical insurance, you have to go for an annual checkup. So, like, you will not be penalized for it if you don't do it, but generally, here in the health insurance system is such that the annual checkup is covered by the insurance companies, and usually people, it's just a social culture that people go for a health checkup, and under the insurance it's covered and you have these routine checkups. So that is a totally different thing. But Kamalji, what I want to talk about today is about the health system in India, because I have worked with the public health and nutrition system in India for several years, and I was here in the health system being treated for cancer. So as Fran very rightly pointed that there is no such thing as a perfect health system. Okay, if I can talk about the advantages or the good things in American health system, I can also talk about the loopholes, right? Similarly, I think even the Indian health system, it may be having certain loopholes, but it has a lot of strengths on its own. And as Fran very rightly said, what we need to do is that capitalize on the strengths of the Indian health system. And whatever are the shortcomings or the weaknesses of that health system, we can build upon it. I think that's the way we go forward in India. First thing is that as far as cancer identification, early screening, treatment, everything is concerned, it has to be a holistic approach. It's not just a treatment, medication, and hospital visit. I think the way WHO puts the concept of health as like physical and mental and emotional and everything together, I think that is relevant for every disease. But I think as far as fighting cancer is concerned, I think it's really, really essential, because cancer is not just about getting medicines. It's also about immense amount of psychosocial support, mental support. And a woman who goes through breast cancer may have a lot of issues around body image, even post surviving the treatment. And she just may struggle with a lot of mental issues regarding to her body image and the scars on her body. And that is a big challenge that women face. And we are not there that we talk about it. So it's not just like treatment, it's so much other things. Then cancer has a lot of financial burden on a family as well. And it's not just about the rural families. I think an average middle class family in India, or even people who are like well off, I think the financial burden of a cancer is very, very immense on a family, especially if the bread earner of the family becomes a patient, or even if the bread earner of the family becomes a caregiver. Being a caregiver to a cancer patient is a full-time job. And it's mentally and emotionally very exhausting for the caregiver too. So there were just like a few points that I wanted to put forth about the Indian health system, about what are the areas where we can strengthen to bring about this integrated approach. First thing is that India has an excellent system of grassroots level workers. In terms of the Anganwadi workers, the Ashas, the ANMs. I mean, that structure is really, really the strength of Indian health system, I think, because it is through this grassroots structure that we must remember that we eradicated something like polio in our country through the rounds, right? So Indian health system has immense power because of that grassroots level presence that we don't have it here in US. I think that's the biggest structure. And we really need to use this grassroots level to reach out to every corner of the country. And these women, as someone was very rightly saying, they interact very closely with the women in the communities. You know, because of the pregnancy, the delivery, and even birth control and reproductive health issues, they are used to talking to them. So I think we have trained our health workers on like IMNCI module in India. So why not train our entire cadre of workers, grassroots workers, on simply self-examination of breast? You know, and they conduct these Mahila Mandal meetings and these kind of group meetings. So I think that's how it has to go. And I think awareness, there is this, you have been into health communication. So I think that 360-degree approach that we talk about, it's not just that breast self-examination and this kind of issues has to go through the women in the family. You can talk to the adolescent girls through, you know, Kishori Shakti Yojanas. There are panchayat, sarpanch, men can talk about it, that okay, the women in your family, your wife, your mother, or anybody else. So it has to be a 360-degree communication from every front. There is a message for women that take care of yourself and examine your breast, and for even the men in the family to really ensure that the women in their family are safe. I think that's very important. Second thing that I wanted to talk about.
Shivani, let me come back to you for the second point, but there's an important point which you are highlighting. Friend, if I come to you and Shivani sitting in US and having worked in India's public healthcare system, is highlighting an important aspect that we have a massive base of grassroots healthcare workers or support workers in form of Anganwadis and Asha and ANMs. And you talked about that we Ayushman Bharat and PMJ, which is providing that support in terms of if there is a need of tertiary secondary healthcare, that world's largest healthcare publicly funded healthcare support system is also in India. How as per you, the big cadre of healthcare support system can be trained for a holistic approach and support to the society, and what kind of role companies like yours can play in that, keeping in mind that having such a large population, as you yourself mentioned, that one government or one company, one organization may not be sufficient to do so. What kind of contribution everyone can do, and especially let's say a company like yours?
It's an excellent question, and because what I like is it's what we're now doing is we're looking at the strengths of India and how we can use the strengths of India to solve the issue that patients are facing. And for me, one of the things that we've learned, and it's been mentioned a couple of times already, is that it's absolutely crucial that whatever the education is or whatever the communication is, that it's co-created with the people that need to hear the communication. And we had a very recent example in Australia where we were helping the government in the rural areas, so where the Aboriginal and tribal individuals are living. Again, they have a huge problem from a screening perspective and an early detection. So there they have a bus that drives around the Northern Territories. It takes 365 days and it makes its way around the Northern Territories. It stops in towns, people know where it is, and they have communication, they have training, and they have materials. But the materials have been created by patient associations, from women like Shivani explaining what it meant for her to find the lump, to have the diagnosis, and to have the treatment. The treatment piece is important because you don't go to get screened and diagnosed if you don't think there's hope. If there's no reason for someone to tell me that I have cancer because I'm just going to die from it, then I don't go and get screened. So you have to have the hope there, and then stories. stories are so important for rural populations in a country like India. If you can get those positive stories, and we heard one story from Australia. It was an island off the Northern Territories, and a lady was diagnosed. She was screened. She was treated. And then she was back on the island, and the story spread. The next time the bus was, up on the coast, it was full for a day of women lining up and queuing up to get screened because they could see the benefit. So for me, the importance is make sure you're including the stakeholder that you want to communicate to. So if you're training the ASHAs, then make sure that you have some ASHAs involved in, what would help them, what would make them feel comfortable in training somebody how to do a self-examination. And one other, so you ask what a company like Novartis can do. We can share best practices from what we've seen, but also we can help from a medical education perspective as well. And one thing we have done in India, we've partnered up with Jaipigo in the state of Odisha. And what we're doing there is really looking at that continuum of care and who needs to be involved in the continuum of care so that we can make it, as efficient as possible. And the other thing we do is we spend a lot of time training NGOs. And so there we work, I think it's with SP Jain. And to date, we've trained over 60 NGOs, again, to have that communication, to get that story out. And my final tip is really small things can help. So we asked the lady, the nurses that were driving around the Northern Territories on this screening bus, we said, what would help have more people come and get screened other than the positive stories? And they said, something simple like a T-shirt. If you could just provide us with some T-shirts, and you imagine you could even have on the T-shirt the different ways for self-examination or the different signs to look for, because as Dr. Uma pointed out, it's not just a lump, maybe it's dimpling, maybe it's discharge, but you could have the things to look for. Something as simple as that, and they said we'd probably double the number of ladies that would turn out to get screened. So I think start with the patients themselves.
Thank you. So an important aspect which you are highlighting, Fran, is that with something like Ayushman Bharat, we have a support system where actually if somebody is diagnosed of something like cancer, and especially those have nots, they have that the support system where they can seek help and get treated. And those who can afford private healthcare, definitely they can afford private healthcare. So this at least should encourage more people. And as you are mentioning about that, the story of hope which are being generated by many such schemes, also reach out to the people, which can encourage a better health seeking behavior, as well as more efforts towards prevention. Dr. Anand Bhan, Shivani was mentioning about the strength of our public health system that is definitely has shown its mettle when it comes to polio eradication. It has been done tremendously well, and it's a testimony for the world. And also the power of communication, which she mentioned about. And then what we are seeing in terms of COVID-19, also a strong, effective, consistent communication help people go for a lot of preventive behavior, whether wearing masks or avoiding public places. Though of late we are seeing a little bit of diversion also, but at the same time it definitely kind of got into the very behavior of the people. Keeping both these things in mind, what is your suggestions that how we can actually scale up or utilize these two strengths, which is one is the communication, where the top leadership of the country is exhorting people that maintain a certain way of behavior, and then one example where people reaching out door to door and ensuring that vaccination is happening of the child. Uh, can this happen for the something like, let's say, a comprehensive women health, where this kind of support can reach out to door? Is it a priority issue, as you said, that women are taken care of in India, especially around reproductive age, or it is something which is happening and can be scaled up?
Well, certainly has to be scaled up. No, I think all of us recognize that the earlier we catch any non-communicable disease, including cancer, the better it is for the health system, because the more money you will save, the more women who end up with advanced disease of any kind, the more money either they will spend from their own family, their own personal savings, or the health system has to spend it on them if it's the public sector. What we need is reinforcement, certainly, but we also need role modeling, which is to say that, in the same way that we have talked about polio and normalize that conversation, or actually now TB as well, the way there are public ads around TB, for example. Why not talk about cancer as well? We see that with tobacco in some way, that, you have all of these ads on national television about do not smoke, it can cause cancer, or do not use tobacco. Why not have open up conversations where we can talk about any form of cancer, breast cancer, cervical cancer, as well. So we have to normalize those conversations, and we need more role modeling from celebrities, from our politicians, which, so that the shame element of it goes away, and it is something which people can talk more comfortably about. The second thing, I think, is leveraging our health system. As we said, we've already talked about transformation earlier in the program, but I think what is also important then is to talk about the role of innovation. I mean, that's another thing where I think in India, we've now had a lot of focus on innovation. So, low cost diagnostics, point of care, platforms which can help. So if you can use telemedicine, now that we know telemedicine has been legalized in a way because of COVID-19 in many ways, then how can we leverage that? So how can we leverage the use of technology and our increasing penetrance of mobile telephony in rural areas, so that you have support mechanisms. So if frontline health workers have a doubt, then there is a way for them to be able to confirm it immediately, or to reach out to someone who's a specialist, because we cannot get specialists to every village, but we can get probably technology and use that and leverage that. And then we need to have support mechanisms so that people feel comfortable that, if they have made a mistake, then there is a way to support them. If they need to get someone referred out, then there is a mechanism to do it. As communities start seeing that the health system is responding to their needs, they will probably also start hopefully changing their behavior, and they will start internalizing it. They will go early for their screening. They will listen to the health worker when she says that you need to go in and see a doctor at the PHC or the CHC or the district hospital, and we will support that by having a mechanism for one of us to accompany you, or have a prioritized way of you going and not having to sit in line for 12 hours to see a specialist, but there will be a way for you to see someone quickly, because we've already sent in all of our records. We've used electronic medical records, we've used the National Digital Health Blueprint, etc., and that hopefully should make a difference. So these are the kind of changes we need to see, not just for breast cancer, but across the health system. But it could certainly have benefits for breast cancer awareness, as well as treatment and promotion as well.
So thank you for bringing in discussion this national digital health mission also, and I'm sure that innovation which you are talking about is definitely going to expedite things. Dr. Uma, with this new focus on digital health, records, digital health, kind of network and digital health mission, how do you see the line of healthcare, or the support for patients is going to change in days to come, and especially as you highlighted in your earlier statements, that today you get a lot of treatments, or not treatment, but you are able to see reports through telemedicines. You are really able to consult or counsel patients through telemedicine. So then how it is digital health mission is going to change the practice, and also the availability, accessibility of healthcare for patients?
So I think telemedicine has already started revolutionizing the whole health system. So, now people are more comfortable taking second opinions. So, somebody who's sitting in some other city, they want a second opinion from Bombay or from somebody, you are more easily able to connect to another doctor in another city, sitting at home, getting an opinion. And this is definitely, I think, going to be a game changer as far as opinions are concerned. But in cancer treatment, if we are talking about breast cancer today, so regarding breast cancer, there has to be some treatment also. So there are certain treatments which are probably a little more specialized as far as cancer therapies, there's targeted therapy, there's immunotherapy, there's a lot of things that are happening. So with that in mind, access to getting the drugs, access to getting that treatment is also very, very important. And that might be a little challenging, because, to be able to train the district hospital to deliver that kind of treatment may be a little difficult. So, to have peripheral centers where that kind of treatment will be done, that is also something that should be focused upon, because delivering treatment is obviously the ultimate goal of getting a diagnosis, like Mrs. Fran pointed out earlier. So if patients are going to get the treatment, then they don't mind coming, getting the diagnosis. But after the diagnosis, now you have to go to for treatment, you have to go to the city. See, people in rural areas, to stay in the city is expensive, to stay there and take the treatment. So they kind of tend to not go. So that is also something that is very important, I feel. Not just diagnosis, but even delivering the treatment.
Yes, thank you so much, Dr. Uma. So now we are, almost towards the close of our session. It's been almost 1.5 hours of this discussion. It has been wonderful to understand these various aspects of breast cancer prevention and management in our country. Before we sign off for today, I'll like to have a quick remark from all of you, that the message which you want to deliver to the people, and especially we understand that the system approach need to be taken, system changes need to be brought in, but at the same time the whole philosophy of this month-long initiative which we took is to spread more awareness, make people understand that take action when it comes to your health. So let me begin with Shivani. And Shivani, what is your message for the people who are watching and will be watching this show? How we can actually move towards making India have very less breast cancer in cases, or maybe being a breast cancer free?
Well, I think the first thing that I want to say is that early detection is the key to cure. You cannot really prevent cancer. You can reduce the risk, but you cannot prevent it generally. So early detection is the key to cure. Try and get your cancer detected as early as possible. And there's just one thing that I want to say. Indian health system has a lot of dots, which are positive points for cancer care. For example, the grassroots workers, the Ayushman, we have the Indian Cancer Society and a lot of other such civil society organizations. What we need to do is that connect together all those dots and form a safety net, wherein if a person is diagnosed with cancer, the person has the confidence that, okay, there is a safety net which has all these components and I'm going to be safe.
Thank you. Thank you so much. Fran, your message.
So first of all, thank you so much. This session has been wonderful. I think the one thing that I would leave the group watching with is focus on the strengths, the inherent strengths that India has in order to be able to solve this problem, and make sure that despite all the requirements for collaboration, because this will never be solved by one party alone, make sure that you put the patient at the absolute center of any solution that you design. Then it will be fit for purpose.
Dr. Anand Bhan.
Yeah, so I think this discussion and the whole campaign, I think, we need to take it to every part of India. I think, we need to normalize conversations around women's health of, including normalizing the fact that, this is something which could impact anyone, and we have all been touched by it in many ways. So I think if we can normalize it, we can make sure that our health system is prepared. It's sensitive to the needs of women, especially from a health perspective, and we can ensure that there are touch points available which are accessible culturally and contextually relevant. Then we can increase both our screenings, we can increase our prevention, we can increase our promotion and treatment activities. And hopefully we'll see more of that.
Thank you so much, Dr. Bhan. Dr. Uma, if you may like to add something.
Yeah, so my message would be, do not fear the word cancer. That's very, very important. One has to understand that we can deal with it. And like Shivani is the living example, it can be cured. And the second most important thing is educate the person right next to you. You don't have to go into a community and talk aloud. Just educate the person right next to you, educate somebody in your office, educate your daughters, so just spread the word everywhere that, you can get cured and how to take care of yourself and you should put yourself first. That's my message.
Thank you so much. Manish जी, आप पिछले 1.5 घंटे से हमारे साथ जुड़े रहे. Thank you so much. आपका क्या मैसेज है? आपने बोला है कि कैंसर से डरना नहीं है और सपोर्ट करना है, बट उसके अलावा आप और एक बार फिर से क्या कहना चाहेंगे?
बस मतलब अपने घर के अंदर जो भी बेटी है, बहू है, उसको आप पहले से ही बताओ कि इससे कुछ डरना नहीं है, और अपने आप मतलब उसको चेक करने की भी जो प्रोसेस है वो एक बार डॉक्टर से सीख ले तो घर पे भी आप चेक कर सकते हैं. मेमोग्राफी वगैरह जो भी मतलब करना है वो कराएं. इसमें डरने वाली कोई बात नहीं है और एकदम मतलब किसी से छुपाने वाली भी बात नहीं है. ये तो घर में आप पूरा खुला होकर चर्चा कीजिए इसके ऊपर.
Thank you so much, everyone, all of you. The gist of the whole discussion has been that normalize the conversation around cancer. There is no need of fear. It's just another health issue which all of us are susceptible to get, and it is our responsibility to be alert, aware, and seek help when it is needed. And at the same time, as all of our esteemed panelists highlighted, that Indian healthcare system, despite many of its issues and problems, has inherent strength. It is having some of the most remarkable testimonies where we have won over something which was kind of hampering the health of our people. And similarly, we can do even with the cancer. And as all of you highlighted, that educating the person next to us, the person who is in our family, is going to be the key for detecting and curing cancer. And for this, we at ISW Council, with the help of Novartis India, have been running a mega campaign for the last 1 month, and also to make every woman and man become the ambassador of good breast health. We began a mass movement of taking a place that each one of us will talk about breast health with at least 5 women in our life, whether it is our home, our office, our social circle, or through our social media channels. So everyone is connected with so many people, and if each one of us take this responsibility of educating or sharing this information at least with 5 women in our life, it is going to be an important. So this is the place that can really save the lives of so many women who get impacted with breast cancer. The lawmakers, social influencers, social leaders, and medical experts who have been joining us to chart out the way forward to prevent breast cancer in India have also shown their exceptional support to this campaign. We are also thankful to Novartis for their support, and we will request all of you as well to sign this pledge. We request our panelists as well as viewers today to sign the pledge by clicking the link on the comment box of today's live show on Facebook and other platform. And people can also visit in our website www.iswcouncil.org/India-Act-Against-Breast-Cancer. So or if you go to our www.iswcouncil.org. You will get a tab there also. After you place it on the link, you will receive a certificate with your name on it. Do share that certificate on your social media platform by tagging 5 people in your circle, in your family, and make them also be part of this movement and become the ambassador of good breast health. And let us help fight against the breast cancer and ensure that we save as many lives as possible from this disease. So with this, thank you so much for joining all of you today on this session. We will be back day after tomorrow. Yeah.
I would just say that let's not stop this at the end of October. Let's continue it throughout the year. Just not only.
So let's not make breast cancer discussion only in the month of October. Let's make every, as we said, 21st of October, we decided to make Breast Cancer Action Day. But let's not make it only just 21st of October. Every 21st of every month, people should try to spare some time to put a focus on their health. It can be or through a self breast exam, or encourage the people, women in your family to do the same. And also the men are not completely out of the danger of breast cancer, so even men need to be careful and alert as well. So thank you so much all of you, Dr. Anant Bhan, Dr. Uma, Fran, Shivani and Manish ji, for joining us today on this session. Hope it will help us, taking this message to more people. We will be back day after tomorrow with our last show of this session. But at the same time, the campaign and then the movement against breast cancer is not going to stop with the end of October. It is going to continue, with the similar force and focus from our side and from our partners like Novartis and everyone, like the survivors and winners like Shivani and many others who joined us during this 1 month time. They will all be taking this torch of awareness and education and action forward. Thank you so much. Have a great days ahead, and good night.
Thank you.
Thanks, Kamal. Thank you
so much.
Thanks for the